Drug delivery to the lung comes with several advantages. For once, it is a targeted delivery to the lung, which allows for lower doses and minimizes toxic effects. It is also a great door for the systemic circulation, and it avoids the first pass metabolism, and all of this in a convenient way. No need for needles, just an inhaler that can be in your pocket and being used at any time and any moment. However, this does come with disadvantages. For instance, a rapid clearance, which means high peaks of concentration and immediate disappearance of the active pharmaceutical ingredient from the lung. This may lead to repeated administrations, which many times also leads to patient compliance not being the best. So, a possible way to improve therapeutic efficiency, decrease systemic side effects, and also decrease concentration peaks that can be toxic to the lung tissue is to develop a sustained release formulation for drug delivery. And this is what this presentation is about. My name is Beatriz Noriega Fernandes, and I am a scientist from the Drug Product Development Group at Ovion. So let's divide this presentation by different questions. The first one being how to choose a suitable DPI formulation. I present here two options: the standard option, carrier-based formulation, which we can mix our micronized API with the carrier, and the second option is engineered particles, in which we are able to design a specific particle for a specific API with target aerodynamical performance that is optimized for inhalation. Another great difference between these two formulation strategies is the manufacturing process. While the first is composed by different steps from API crystallization to micronization, followed by formulation, which are challenging and require tight process controlled parameters. The second formulation, the engineered particles, only required a one-step process, which is spray drying process. This process includes a feed solution, which is composed by API, the excipients, and a solvent mixture, which is then spray dried and leads to a specific particle depending on the formulation used, on the API used, and on the process parameters. More in detail, we can see here a schematic of the spray drying process. And this is something that is very well understood in the literature, and specifically at Ovion. We have been working with spray drying for more than 10 years, and therefore we have developed models that are able to predict what to expect at different parts of this process. For instance, we do have thermodynamic models that we use to set up process conditions even previous to any work in the lab. There is also an atomization model that we use in which we are able to predict the droplet size and the particle size, which is specifically important when developing spray drying formulations for inhalation. So based on this is the second question: how can we develop a DPI spray drying formulation? So a spray drying formulation specifically for the lung. We divide this in three stages, the first one being the in silico stage, which we look at different excipients and also at the way they could behave with the API and within the spray drying process, and we minimize the choice to a number that can actually work for what we are trying to develop. Secondly, there is a laboratory scale screening. We can use up to 12 systems, and they will be manufactured and characterized specifically for solid state and morphology, as well as aerodynamical performance. And this would be the way to select a top 2 prototype formulations, which will then be evaluated also for this solution using the paddle over disc apparatus. This means that specifically the fine particle fraction of the powder or a specific stage of the NGI will be used to evaluate the dissolution performance. and also tested for stability, as this is one of the main critical attributes of the product. Once the top formulations are selected, we move on with the optimization and fine-tuning of the process for these specific formulations. And the goal of this work is, on the one hand, to again have an optimized process, so an optimized particle size and also an optimized yield, but also to determine scale independent parameters that can be used for a smooth scale up with minimal testing. We can go from the lab scale, from pilot, small production, and even full production. And this is something we can do easily following this strategy that I just mentioned. So also based on that strategy, we did put together a universal DPI platform, which we were able to test for different APIs and saw that the aerodynamical profile was independent from the API when in low doses, and also tested for stability for APIs and for the placebo, showing that this is a stable formulation for more than 6 months. And our main goal here would be to develop a sustained release formulation that we can implement looking at this universal DPI platform. So, third question, how to achieve a sustained release in the lung? Looking at literature, we do have different possibilities. However, there are a limited number of excipients that are approved for inhalation, some sugars, some amino acids, and some lipids. Therefore, we will focus on liposomes, micelles, and solid lipid nanoparticles, which can be developed only with the excipients that are approved for inhalation. And this can be delivered to the lung by nebulization, but also as a dry powder. And since the dry powder has an improved stability for these types of structures, this really seems like the optimal strategy. So our experimental design included two formulations. One would be the universal formulation using the fluticasone propionate as our model drug, and the second using around 30% of the SPC. And the main goal is to assess if this universal formulation is suitable to manufacture a sustained release formulation and ensure a straightforward scale-up. So for the second formulation, we started by generating liposomes or solid lipid nanoparticles by ethanol injection. Following that, we did pass this mixture through a high-pressure homogenizer to assess if this process could have any impact on the structures, bearing in mind that in future work, when thinking about scale-up, this process could be possibly used. And no particle size distribution change was actually detected. Lastly, spray drying process was used to spray dry the formulations. The optimized conditions for the universal formulation were used, and they were similar for the two formulations. Lastly, the powder was filled into capsules and characterized. Thinking first about the spray dried powder, the particle size analysis showed there was a slight increase on particle size. However, please note that the DV90 is still within the inhalation range. However, it is slightly larger than the universal formulation, and this indicates that the presence of the DSPC may lead to a different particle generation and therefore a larger particle, but this could be easily optimized by changing spray drying parameters. Looking at the XRPD data, the diffractograms do show a similar profile for both formulations, which is also similar to the profile obtained for all the previously formulations manufactured with these excipients and with this process, indicating that the SPC does not have an impact on the solid state of the excipients or of the API. And lastly, when looking at the drug product performance, we can see that the fine particle dose does decrease. However, this is expected due to the particle size decrease and again can be optimized easily by changing spray drying parameters. However, it is still fairly good fine particle dose. It's higher than 50%. And when looking at the dissolution, the paddle over disc apparatus was used. This means that the fine particle dose was collected and then used for the solution. And here we can clearly see the sustained release impact of the DSPC and of the structures generated during the ethanol injection step. And we can see that 50% of the dissolution is shifted from around 30 minutes to around 90 minutes. So it takes 3 times longer. So main conclusions here are that the addition of the DSPC to the universal DPI platform has a sustained release effect, and also that the process can be, of course, used as is, but can also be further optimized to maximize performance. So if you have any questions, please feel free to email me with those, and thank you very much for your attention.